Good morning. In last class, we had discussed regarding the national health problems. In previous videos, already uploaded what is national health policy. This is part of the question paper and answer discussion. Here, one more time, we are discussing important points of the national health policy. In September 2019, University asked this question: what is national health policy? Mainly three national health policies there. Already last video, please watch. You can come to know the detailed note of the national health policy. Here I am just mentioning some of the important points due to time. So mainly three national health policies are. First one 1983. Here it focus to what are the problems facing in the community and in country, especially to create awareness of health problems, maintain safe drinking water and sanitation, improve the rural health services. Some of the legislative support is formed, and another target is combat against the malnutrition. Research they are focused more, and some of the coordination about the different system medicine is nothing but Ayush. This all of them focused in 1983 national health policy. So first one is the 1983. Then these are the some of the goal. This everything uploaded in last video detailedly. Not going this one. Then 2002 national health policies mainly target a better health care, and which all of them goals not met at last in 1983 national health policy. Here government is focused on that national health policies. So especially revised the policy government and health professional to render a good health care to the society. Main objective are acceptable standard of good health of the Indian population. Second one, decentralizing public health system. Centralized public health system. Need to focus centralized. In before it is health and family welfare services separately. This national health policies begin that one service system is one integrated healthcare system is begin, that nothing but Ministry of Health and Family Welfare, that integrated part it came under the CCHS and DGHS. Then equitable access to the health service, equal health services in the every area. Then another one is a contribution private sector also providing more care, all of them can be affordable to pay. Then another one, rational use of drugs, emphasizing the rational use of drugs. And another one, increasing access to try a system of traditional medicine, especially Ayurveda, Unani, Siddha. This all of them is motivated. These are some of them goal. This is everything we are discussing last time. Some of the legislation came: eradication polio, elimination of leprosy, and more public health service include, and 1% for the total budget in medical research. Decentralization is beginning. 2007 is targeted zero level growth of HIV and AIDS. 2010 elimination of Kala-Azar and reduction mortality of 50% to the TB, malaria, other vector and waterborne disease. Then next one, reduce the prevalence of blindness 0.5%. Next one, reduce the infant mortality rate 30/1000 and MMR maternal mortality rate 100/1 lakh. Please note 100/1 lakh. Increase utilization of public health facilities. Okay, these are some of the things, grant and everything. Then elimination of lymphatic filarias, and here in before we are in 2010 it is in 2% of medical research fund. Now it is increased 2% of health budget for medical research. This will come under the 2017. And mainly there is three things focused on: increasing accessibility, improving quality and lowering the cost. These are the principles. These are the objective. First one, assuring availability of free and comprehensive primary health care. Free and comprehensive care. Then another one, improve access and affordability of quality of secondary and tertiary care. Which care? Secondary and tertiary care. And next one, reduction of expenditure to the health costs. Then next one, reinforcing trust of public health care system. They are more focused on public health system and growth of private health sector with the public health goals. These are the some of the goal achieved in 2017. These are the goal. Then this everything we are discussing in last video, so I am not going detail. These are the main difference. This will discuss here. What is the difference between National Health Policy 2002 and 2017? The almost which all of the not achieved in 2002, that mainly focused in 2017. Reduction of infant mortality rate, there is a small changes. In 2002 it is 30, now it is 28. MMR is same only. Then increase public health expenditure 0.9 to 2. Now it is in 1.16 to 2.5 GDP. Then mortality TB is 50%, and eradicate leprosy 2005 it is now modified in 2018 and 17 respectively, and lymphatic filariasis is eradicated in 2015. Now it's small changes happen. 2017 that lymphatic filariasis eradication is modified, and 55% of total public health expenditure in public health care it increased in 66%. That is some of the main changes happened in 2002 to 2017. What are the policies will come under this 2017? Swachh Bharat Mission, balanced health diet and regular exercise, Yatri Suraksha, Nirbhaya, Nari, reduce stress and improve the safety in workplace, reducing indoor and outdoor air pollutions. This all of those some of the policy ideas came in 2017. Some of the key factors. This everything we have discussed. National health programs. This is a human resource for health. Okay, then another question the university asked in May 2017 is nothing but national population policy. This video, detailed video also I will upload later. First one, national population policy is felt since in 1970. It drafted in 1976. If it possible, please remember time. If you are not sure, please won't write date, year. If it's sure, then only you write year and everything. Otherwise, your mark will lose. So, if you know, pakka, you write year. The policy statement on family welfare program was also prepared in 1977. The both passed in Parliament. National Health Policy 1983 emphasized small family norms. You know, small family norms. There is a three objectives. First child, second child after the 3 year, male or female, 2 only. Then family planning, adaptation of the family planning. Okay, these are the main small family norms, main target. This based on the national population policy main target. We need to underline this point: population stabilization. Which one it is? Please repeat: population stabilization. Okay. Then which are the main features of national population policy? Increase the age of marriage 15 to 18 year for girls and 18 to 21 year for whom? Boys. Fine. Then another one, the population figures 1971 level until the 2001. Freeze. Population figures. Freeze means to zero growth level of population. That is target. Still not achieved, but that government sector and everyone is ongoing that work. Freeze the population figures. Okay. Then another one, make some portions of central assistance, provide the states depend upon their performance in the family planning. Central assistance in the family planning, not the point, central assistance. So central government is making initiate in the family planning. I am remembering when I worked in North Karnataka, what they did to control the family, not family, control the population. That family planning methods, commonly in condoms and everything, will be available in 5 rupees in even roadside also, especially in a private bus stand, transport bus stand, everywhere it's available in 5 rupees family planning methods. In not this time, in 2010 and all. So this is everywhere. I think in Kerala it's not visible like that, but in nowadays that family planning method is one of the main target of the family planning programs. So stabilization of population and give a greater attention to the education of girl. This is one of the main things. Education for girls. Education. Then another target is a population education. Population education. Then another one, ministries and department of government in family planning program. Okay. Then and compensation for the sterilization, increase the compensation for sterilization, some of them payment government is paying. Then another one, group awards, who are them doing in which Jilla Parishad Panchayat something who is doing effectively, for them government is going to provide the group awards. Then another one, encourage the voluntary organization, especially representing women. And another one, importance or give more importance to the research activity regarding to how to control the population. And another one, mass media. This is one of the best things to control the population. Mass media methods, the family planning methods. Next one, National Population Policy in 2000. In 1998, draft of National Population Policy is finalized after Constitution. It was approved the Cabinet, examined by the groups of ministers, discussed Cabinet 19th November 1999, and it is revised in 15th February 2000. Okay. First objective, immediate objective, to address the unmet needs for contraception, healthcare infrastructure, and health personnel. What is the immediate objective? To address the unmet needs for contraception, healthcare infrastructure, and health personnel. To address the unmet needs of contraception, healthcare infrastructure, and health personnel. Next one, provide integrated service delivery. Integrated service delivery for the reproductive and child health care. Integrated service delivery. Then median goal, to bring total fertility rate replacement level at the 2000. Then long time stable population at the 2045. When 2045. And another, some of them, universal immunization, delay the marriage of girls, then improving the institutional delivery, and 100% delivery should be attended the trained persons. And another one, universal access to the information and counseling, especially in fertility regulation and contraception. And another one, 100% registration of birth, death, marriage, and pregnancies. Next one, national socio-demographic goals in 2010. This one of them, basic reproduction and child health service. Second one, school education compulsory up to 14 year, and reduce infant mortality rate. Now it is in not 30, now it is 28 bar 1000, and MMR 100 bar not 10,000. It is previous calculation. Now it is 1 lakh 100 per 1 lakh live birth. Then spread of AIDS and promote the great integration between the management of reproductive tract infection and sexually transmitted infection, prevent and control the communicable disease, integrate the Indian systems of medicine program. And next one, small family norms. Next one, bring about convergence in implementation of related social sector program in family welfare program to the people-centered program. So these are some of the themes. I'm going to leave this everything. Then next one, in April 2020, University asked 11th 5-year plan. 11th 5-year plan. Then another one, we need to focus nowadays in 12th 5-year plan also. This 12th 5-year plan I will upload in next video separately. So here we will focus some of the main points of 11th 5-year plan. 11th 5-year plan is 2007 2012. Now it's running 2012 5-year plan, and GDP growth from 80 to 100% and maintain 10% in the 12th 5-year plan. GDP growth from 8 to 10 and maintain 10% at the 12th 5-year plan. Gross domestic product. 70 million new work opportunity. This is another target, and reduce unemployment below 5%. And another one, raise real wages rate for the unskilled workers. Then reduce poverty. Then education, which all things is focus, reduce drop rate of the children from the elementary school from 52.2% 2003 to 4 and 20% in the 11 to 12, and develop minimum standard in the education. Minimum standard, increase literacy rate and low gender gap. I think this gender gap and everything we are achieved now already. Then health and nutrition. The good health in both and end itself also contribute the economical growth. This note is directly taken from the government's website. The good health both and end itself also contribute to the economic growth. Meeting the health needs of population required comprehensive and sustainable approach. Our health service should be affordable and reasonable quality. That we need to underline. The main target, the health service should be affordable and reasonable quality. It's a need affordable, not only affordable, reasonable quality care. And another one, the 11th 5-year plan strengthen healthcare system in preventive, promotive, curative, palliative and rehabilitative. It is not my words, it's directly taken from government this site. It mainly focused on preventive, promotive, curative, palliative and rehabilitative. And this also accompanied, which are things, clean drinking water, then sanitation, then diet, hygiene, feeding practice. I will repeat: safe drinking water, sanitation, diet, hygiene and feeding practice. Okay, this is the focus on health and nutrition. And the other point is the what are the changes happen through this National Rural Health Mission with the 11th 5-year plan. 5 lakh ASHA workers in every 1,000 population, and sub-centers, nearly now 1.75 sub-centers is that in functional 2 auxiliary nurse midwives by the 2010. Then PHC, nearly 30,000 is there with 3 staff nurses. Sub-center 2 ANMs and PHC 3 staff nurses and 6,500 CHC strengthen and establish specialized care and 9 staff of the nurse in 2012. This everything, if it possible, please thorough, because you can point out this everything in the whenever if they ask in question. And 1,800 taluk and subdivisional hospital, 600 district hospital also strengthened. Then mobile medical unit begin in the each district, and functional hospital development committees begin in CHC, SDH and district hospital, sub-district hospital, CHC and district hospital 2009. And grant and annual maintenance is provided to the sub-center, CHC and everywhere. And district health action plan completed in when? 2008. District health action plan. These are the main point focused on 11th 5-year plan through the National Rural Health Missions. Then another one, some of the main points: good governance, transparency and accountability in the delivery of health, nutrition and related service, ensure the involvement of local self-government, community and civil service. So 11th 5-year plan aim to establish 60 medical college. Their aim is to establish how much? 60 medical college. And another point we need to focus, according to the NFHS 3, 38.4% of children under 3 years were stunted, 90.1% is wasted and 45.9 is underweight. 98-99 survey based, the wasted children has been increased. BMI, body mass index, 33% of women and 28% of men is below normal. Please note, 33% of women and 28.1 of the are below normal. This is a rate. And prevalence of anemia is very high among the young children, even the married women and pregnant women also. Then the variety of interventions, consistent dietary diversifications, nutrient supplementation and public health measure involving better hygiene, sanitation, deworming. This is focused on to prevent the malnutrition. Better hygiene, sanitation, deworming. Under the ICDS program, addressing the problems of malnutrition and universalized on the fully decentralized, demand-based and restructured 11th five-year plan. Decentralized demanding begin under the ICDS. Okay. And hot cooked meals and extensive promotion to the infant and young children is provided, and the midday meal program and everything is begin under this. And another one thing is there, this focus on women's health, especially maternal mortality and morbidity, child sex ratios, this everything they focused, and they encouraging institutional delivery under the NRHM, National Rural Health Mission, who will conduct the institutional deliveries, and they're trained at 100% TBS. What is the full name of TBS? Trained birth attendants. That nothing but if all of them unable to do the institutional delivery in home basis, a trained person, that is 6-month program, government will provide all delivery kit with the smart stipend also. So that trained person will be attend the delivery. So reducing the travel time to 2 hours for the emergency obstetric, that is a target. Nowadays, in future, that MLHP will be taken this responsibility, that is a government plan. So reduce the traveling to the in the emergency condition. And another one, this plan is focused on reducing infant mortality and home-based newborn care. Reducing infant mortality and home-based newborn care. Home-based newborn care provide who? Asha through the Asha workers and TBS. Okay. So the strategies during this plan introduce and make available high quality of home-based, last this paragraph last words, the strategy during the plan introduce and make available of high quality of home-based newborn care in all districts and reduce the mortality rate 44/1000 labor. Then another one, during to the national programs, 38.4 children under 3 years standard and the body mass also increase. Okay, so these are the some of the main highlights points in the 11th five-year plan. This detailed things we'll discuss in next video. I am going to discuss 11th and 12th five-year plan very detailedly. So I have sincere request, these are the questions we can expect, and one thing you should remember, please study 12th five-year plan also, because still they didn't ask, but we can predict this year. So next video I will upload 11th and 12th five-year plan together. Okay, thank you, have a nice day and study well.